For generations, it's been relegated to hushed tones, whispered secrets passed between women in the quiet corners of locker rooms or scribbled on bathroom stalls. Vaginal health, a topic as natural as breathing, has been shrouded in a veil of taboo, misinformation, and often shame. We're taught to discreetly purchase sanitary products, to shy away from open conversations about our bodies, and to accept discomfort as a normal part of being female. But why the silence? Why the secrecy surrounding such a fundamental aspect of a woman's well-being? The answer in part lies in societal conditioning that has historically minimized women's voices and experiences, particularly when it comes to their own bodies. This silence has had far-reaching consequences. It has created a breeding ground for myths and misconceptions, leaving many women confused and ill-equipped to navigate their own vaginal health. It has fostered a sense of isolation, preventing women from seeking the support and information they need. And perhaps most importantly, it has hindered our ability to advocate for ourselves, to demand better care, and to embrace the full spectrum of our womanhood with confidence and empowerment. It's time to dismantle the stigma. It's time to shatter the silence and reclaim the narrative surrounding our bodies. Vaginal health is not a taboo subject. It's an integral part of our overall health and well-being. It's time to speak openly, honestly, and without shame. This journey begins with knowledge. By arming ourselves with accurate information, we can dispel the myths, challenge outdated beliefs, and make informed decisions about our bodies. It's about understanding the intricate workings of our bodies, recognizing the delicate balance that exists within us, and learning how to maintain that balance for optimal health. It's about taking control, advocating for our needs, and seeking the care we deserve. It's about embracing our bodies in all their complexity and recognizing that vaginal health is not a luxury. It's a fundamental right. Often conversations about vaginal health are limited to discussions about infections, focusing primarily on treatment rather than prevention and overall well-being. While it's crucial to address infections promptly and effectively, it's equally important to adopt a more holistic perspective. Vaginal health encompasses far more than the absence of disease. It's about understanding the intricate interplay of factors that contribute to a thriving vaginal ecosystem. It's about recognizing the impact of our daily habits, from the products we use to the foods we consume. It's about nurturing our bodies from the inside out and embracing a lifestyle that supports not just our physical health, but our emotional and mental well-being as well. This holistic approach empowers us to take a proactive role in our vaginal health, moving beyond a reactive cycle of treating infections to one of prevention, maintenance, and overall vitality. Every woman's body is unique, and what's considered normal can vary greatly. There's no one-size-fits-all approach to vaginal health. This journey is about tuning into your body, listening to its whispers, and learning to decipher its signals. It's about recognizing the subtle shifts that may indicate an imbalance and understanding when to seek professional guidance. It's about building a relationship of trust with your healthcare provider, someone who respects your concerns, listens to your experiences, and provides compassionate, evidence-based care. This is your journey, and you are the expert on your own body. By embracing knowledge, advocating for your needs, and prioritizing your well-being, you can cultivate a lifelong relationship of respect, understanding, and empowerment with your body. Imagine your vagina as a thriving ecosystem, a delicate rainforest teeming with a diverse array of microorganisms. This intricate community of bacteria and other microbes is known as the vaginal microbiome, and it plays a vital role in maintaining your overall vaginal health. Just like the delicate balance of nature, the vaginal microbiome thrives when a harmonious equilibrium is maintained between the different types of microorganisms that call it home. This balance, however, is not static. It's constantly adapting and responding to various internal and external factors, including hormonal fluctuations, sexual activity, and even the products we use on our bodies. Understanding the intricate workings of this ecosystem is key to unlocking the secrets to optimal vaginal health. and empowering ourselves to make informed decisions about our bodies. One of the most crucial factors in maintaining a healthy vaginal microbiome is pH. You've likely encountered pH in the context of skincare or swimming pools, but it plays an equally important role in the delicate ecosystem of your vagina. pH is a measure of acidity or alkalinity, with a scale ranging from 0, highly acidic, to 14, highly alkaline. A healthy vagina maintains a slightly acidic pH, typically between 3.8 and 4.5. This acidity acts as a natural defense mechanism, creating an environment that's inhospitable to harmful bacteria and yeast, while simultaneously promoting the growth of beneficial bacteria, primarily lactobacilli. Maintaining this optimal pH balance is crucial for preventing infections and ensuring the overall health and comfort of your vagina. Within the bustling community of the vaginal microbiome, lactobacilli reign supreme. These friendly bacteria are the gatekeepers of vaginal health, playing a pivotal role in maintaining the delicate balance of the ecosystem. Lactobacilli produce lactic acid, which contributes to the acidic environment of the vagina. This acidity not only inhibits the growth of harmful microorganisms, but also helps to create an environment that's conducive to the growth of other beneficial bacteria. Think of lactobacilli as the guardians of your vaginal health, working tirelessly to keep harmful invaders at bay and maintain a harmonious balance within the ecosystem. While the vaginal microbiome is remarkably resilient, a number of factors can disrupt its delicate balance, potentially leading to discomfort, irritation, and even infections. One of the most common culprits is the use of harsh soaps, scented products, and douches. These products can disrupt the natural pH of the vagina, killing off beneficial bacteria and creating an environment that's ripe for the overgrowth of harmful microorganisms. Other factors that can impact vaginal pH and flora include hormonal fluctuations, sexual activity, certain medications, such as antibiotics, and even underlying health conditions. For generations, women have been bombarded with marketing messages promoting douching as a necessary part of feminine hygiene. However, the truth is that douching is not only unnecessary but can actually be harmful to your vaginal health. Douching involves flushing out the vagina with water or other solutions, often containing harsh chemicals and fragrances. This practice disrupts the natural balance of the vaginal microbiome, washing away beneficial bacteria and altering the pH, making the vagina more susceptible to infections. Antibiotics are powerful medications that play a crucial role in fighting bacterial infections. However, while antibiotics target harmful bacteria, they can also inadvertently wipe out beneficial bacteria in the process, including the lactobacilli that are so crucial for maintaining a healthy vaginal environment. This disruption of the vaginal microbiome can create an opportunity for yeast, a type of fungus that's normally present in small amounts in the vagina, to overgrow, leading to a yeast infection. Yeast infections are characterized by itching, burning, and a thick white discharge. Maintaining a healthy vaginal microbiome is essential for overall vaginal health and well-being. One of the most important things you can do is to avoid douching and using harsh soaps or scented products on your vulva or in your vagina. Instead, opt for gentle, pH-balanced cleansers specifically designed for intimate hygiene. Wearing breathable cotton underwear and changing out of damp clothing promptly can also help to maintain a healthy vaginal environment. Let's address the elephant in the room, or rather, the myth that's been perpetuated for far too long. Your vagina is not a dirty little secret that needs to be aggressively scrubbed, douched, or deodorized. In fact, it's quite the opposite. Your vagina is a self-cleaning marvel, equipped with an intricate system that keeps it healthy and balanced all on its own. Think of it like a self-regulating garden, where beneficial bacteria work tirelessly to maintain the optimal pH and keep harmful microorganisms in check. Just like you wouldn't douse a delicate flowerbed with harsh chemicals, your vagina thrives when treated with gentleness and respect. The natural discharge you experience is simply your body's way of cleansing itself, shedding dead cells, and maintaining a healthy balance. It's completely normal and nothing to be ashamed of. So step away from the douches, the heavily scented soaps, and the vaginal deodorants. Your vagina doesn't need them. And in fact, these products can do more harm than good by disrupting the delicate ecosystem within. When it comes to vaginal hygiene, the golden rule is beautifully simple. Less is more. Your vulva, the external part of your genitals, can be gently cleansed with warm water and a mild unscented soap. However, there's no need to insert soap into the vagina itself. Remember, your vagina is self-cleaning, and introducing foreign substances can disrupt the natural pH and lead to irritation or infections. If you prefer to use a cleanser, opt for one that's specifically formulated for intimate hygiene, with a pH that's compatible with your vagina's natural acidity. Look for products that are free of fragrances, dyes, and harsh chemicals. And remember, gentle is key. There's no need to scrub or use abrasive washcloths. Simply lather the soap in your hands and gently cleanse the area, rinsing thoroughly with warm water afterwards. The world of feminine hygiene products can feel like a minefield, with countless options promising everything from freshness to odor control. However, it's crucial to remember that your vagina is not a problem that needs to be solved. Many of these products are laden with harsh chemicals, fragrances, and antiseptics that can disrupt the delicate balance of your vaginal microbiome and potentially cause irritation or allergic reactions. So, how do you navigate this minefield and choose products that support your vaginal health? Here's a quick guide. Do choose mild, unscented soaps or cleansers specifically formulated for intimate hygiene. Don't use douches, vaginal deodorants, or feminine sprays. Do opt for breathable cotton pads or liners if needed. Don't use scented pads or panty liners, as these can trap moisture and irritate the sensitive skin of your vulva. Do read product labels carefully and choose products that are free of fragrances, dyes, and harsh chemicals. Don't be swayed by marketing hype. Your vagina is not a problem that needs to be fixed. When it comes to vaginal health, the fabric of your underwear matters more than you might think. Cotton, with its breathable and absorbent properties, reigns supreme as the ideal choice for everyday wear. Cotton allows air to circulate, keeping the vulva area dry and preventing the buildup of moisture that can create a breeding ground for bacteria and yeast. Synthetic fabrics, on the other hand, tend to trap heat and moisture, creating an environment that's ripe for irritation and infections. While those lacy thongs and silky briefs might look tempting, it's best to save them for special occasions and stick with breathable cotton underwear for everyday wear. Your vagina will thank you for it. Menstruation is a natural part of life, but it also requires a bit of extra attention to hygiene. The key is to choose products that absorb menstrual flow effectively, while also allowing your skin to breathe. Tampons and menstrual cups are both internal options that can be worn comfortably for several hours. If you choose to use tampons, be sure to change them every 4 to 8 hours to prevent the risk of toxic shock syndrome, a rare but serious bacterial infection. Menstrual cups, on the other hand, can be worn for up to 12 hours and are a more eco-friendly option. Pads, whether disposable or reusable cloth pads, are an external option that can also be effective and comfortable. Maintaining hygiene while traveling or using public restrooms can be a bit trickier, but it's definitely doable with a few simple strategies. First and foremost, remember that your vagina is not going to spontaneously combust if it doesn't come into contact with soap and water every few hours. If you're using public restrooms, opt for toilet paper over those air dryers, which can spread bacteria. Carrying a small pack of unscented wipes in your bag can provide a quick refresh if needed, but avoid using them directly on your vulva. And if you're traveling to an area with limited access to clean water, consider packing a small bottle of hand sanitizer to use before and after using the restroom. Every woman's body is different, and what works for one woman might not work for another. There's no one-size-fits-all approach to vaginal hygiene, so it's essential to listen to your body and find what works best for you. Pay attention to any changes in your vaginal discharge, odor, or overall comfort level. If you notice anything unusual or experience any discomfort, don't hesitate to reach out to your healthcare provider. Remember, you are the expert on your own body. Our bodies possess an innate wisdom, a language of subtle cues and not so subtle signals that alert us when something isn't quite right. Yet all too often, we're conditioned to ignore these whispers, to push through discomfort, to dismiss changes as normal or nothing to worry about. When it comes to vaginal health, paying attention to these subtle shifts in our bodies can mean the difference between catching a potential issue early and allowing it to escalate into something more serious. It's about tuning into the rhythm of our bodies, noticing any changes in discharge, odor, or sensation, and recognizing when these changes warrant further investigation. Remember, your body is your constant companion, and it's always communicating with you. Take the time to listen to its whispers, and you'll be well on your way to maintaining optimal vaginal health. Vaginal discharge is often met with a grimace and a hasty dash to the bathroom to grab a panty liner. But the truth is, vaginal discharge is a perfectly normal and healthy bodily function, playing a crucial role in keeping the vagina clean, lubricated, and protected from infection. Healthy discharge is typically clear or white, with a slightly sticky or slippery consistency, and a mild musky odor or no odor at all. However, when the color, consistency, or odor of your discharge changes significantly, it can be a sign that something is amiss, warranting a visit to your healthcare provider. The dreaded itch. It can be a minor annoyance or a relentless tormentor, driving you to distraction and making you wish for a little peace and quiet down there. While occasional itching can be caused by something as simple as irritation from a new laundry detergent or a stray pubic hair, persistent or intense itching, especially when accompanied by other symptoms, is a sign that something else is going on. Yeast infections, one of the most common culprits of vaginal itching, often manifest with a thick white cottage cheese-like discharge, along with redness, burning, and swelling around the vulva. Bacterial vaginosis, another common culprit, typically presents with a thin, grayish-white discharge and a strong, fishy odor. Pain is your body's way of shouting, "Hey, something's not right here." It's a signal that demands attention, urging you to stop, listen, and take action. When it comes to vaginal health, pain, burning, or discomfort during urination, sexual intercourse, or even at rest should never be ignored. Pain during urination can be a sign of a urinary tract infection, while pain during intercourse can indicate a range of issues, from vaginal dryness to more serious conditions, like pelvic inflammatory disease. Persistent pain or discomfort in the pelvic area, even when you're not urinating or having sex, should also be checked out by a healthcare professional. Our menstrual cycles are often viewed as inconvenient monthly visitors, but they're actually a vital sign of our overall health and well-being. While some variation in cycle length and flow is normal, experiencing bleeding between periods, unusually heavy periods, or bleeding after menopause is a red flag that should never be ignored. Irregular bleeding can be caused by a variety of factors, ranging from hormonal imbalances and fibroids, to more serious conditions like endometriosis or even certain types of cancer. If you notice any abnormal bleeding, it's essential to schedule an appointment with your gynecologist or healthcare provider as soon as possible. We are often our own best advocates when it comes to our health. We know our bodies better than anyone else, and we're usually the first to notice when something feels off. If you're experiencing any unusual symptoms or have a gut feeling that something isn't right, don't hesitate to seek medical attention. It's always better to err on the side of caution and get checked out by a professional. Remember, you deserve to feel your best, and that includes feeling confident and comfortable in your own body. Finding a gynecologist you trust and feel comfortable with is an essential part of maintaining optimal vaginal health. Your gynecologist should be someone you feel comfortable discussing any concerns with, someone who listens attentively to your questions and provides compassionate, evidence-based care. Don't be afraid to ask questions, seek clarification, or advocate for your needs. Remember, you are an active participant in your healthcare, and your gynecologist is there to guide you and provide the best possible care. Sex is a natural and beautiful part of life, a dance of intimacy, pleasure, and connection. And while it's often portrayed as a carefree and spontaneous act, the reality is that sex can have a significant impact on our vaginal health, and vice versa. Understanding the intricate interplay between sexual activity and vaginal health is crucial for women of all ages, whether they're just beginning to explore their sexuality or have been sexually active for years. It's about recognizing that our vaginas are not passive vessels, but dynamic ecosystems that respond to a variety of stimuli, including sexual arousal, friction, and even the introduction of foreign substances like semen and lubricants. By understanding these dynamics, we can make informed choices that protect our vaginal health, enhance our pleasure, and allow us to fully embrace our sexuality with confidence and joy. In the heat of the moment, it can be tempting to throw caution to the wind and forego protection. But when it comes to sexual health, protection is non-negotiable, a responsibility we owe to ourselves and our partners. Condoms, when used correctly and consistently, are incredibly effective at preventing sexually transmitted infections, acting as a barrier that prevents the exchange of bodily fluids. But protection goes beyond simply preventing STIs. It's also about protecting your vaginal pH and microbiome from the potential disruptions that can occur during intercourse. Sex is often associated with pleasure, and rightfully so. But for some women, intercourse can be a source of pain or discomfort, a jarring dissonance that can overshadow the intimacy and joy of the experience. Pain during intercourse, also known as dyspareunia, is surprisingly common, affecting women of all ages and backgrounds. The causes of dyspareunia are varied and can range from physical factors like vaginal dryness or infections to emotional and psychological factors like anxiety or a history of sexual trauma. We've all heard the advice, always pee after sex to prevent UTIs. But is this post-coital ritual truly necessary, or is it just another one of those well-intentioned but ultimately unnecessary hygiene myths? The truth is, urinating after sex can be beneficial, particularly for women who are prone to urinary tract infections, or UTIs. During intercourse, bacteria from the vaginal area can sometimes be pushed into the urethra, the tube that carries urine out of the body. Lubrication is often seen as an optional extra, something you reach for only when things are feeling a bit dry down there. But the truth is, lubrication plays a vital role in both enhancing sexual pleasure and protecting the delicate tissues of the vagina during intercourse. Natural lubrication, produced by glands in the vagina, helps to reduce friction during intercourse, preventing discomfort, irritation, and even tiny tears in the vaginal lining. However, sometimes our bodies need a little help, and that's where personal lubricants come in. Talking about sexual health can feel awkward or even taboo, but it's an essential part of any healthy relationship. Open and honest communication with your partner about your sexual health, including any concerns or questions you may have, is crucial for building trust, intimacy, and mutual respect. It's about creating a safe space where you both feel comfortable discussing your needs, desires, and boundaries without fear of judgment or shame. Start by sharing information about your own sexual history, including any past STIs or sexual health concerns. For far too long, women have been conditioned to view their sexuality through a lens of shame, silence, and societal expectations. But it's time to reclaim our sexuality, to embrace it as a source of pleasure, empowerment, and self-discovery. Owning your sexuality means understanding your body, your desires, and your boundaries. It means advocating for your needs, whether that's asking for what you want in bed or seeking out healthcare professionals who respect your choices and prioritize your well-being. While maintaining proper hygiene is undoubtedly important for vaginal health, it's merely one piece of a much larger puzzle. A truly holistic approach to vaginal health extends far beyond the realm of cleansers and cotton underwear, encompassing a myriad of lifestyle factors that influence the delicate balance within. It's about recognizing that our vaginas don't exist in isolation, but are intricately connected to the overall health and well-being of our bodies. Just as a garden thrives when nourished with nutrient-rich soil, adequate sunlight, and gentle care, our vaginas flourish when we prioritize our overall physical, emotional, and mental well-being. This holistic perspective empowers us to view vaginal health not as a separate entity, but as an integral part of a vibrant and thriving whole. We've all heard the adage, "You are what you eat," and it rings particularly true when it comes to vaginal health. Just as a balanced diet nourishes our bodies from the inside out, certain foods can promote a healthy vaginal environment, while others can tip the scales towards imbalance and discomfort. One of the key players in maintaining a thriving vaginal ecosystem is a balanced pH, and certain foods can help us achieve this delicate equilibrium. Cranberries, known for their ability to ward off urinary tract infections, can also be beneficial for vaginal health. Cranberries contain compounds that prevent bacteria from adhering to the walls of the urinary tract and vagina, reducing the risk of infection. Fermented foods like yogurt, kefir, kimchi, and sauerkraut are rich in probiotics, those friendly bacteria that play a crucial role in maintaining a healthy vaginal microbiome. Water, the elixir of life, plays a vital role in maintaining the health and vitality of every cell in our bodies, including those in our vaginas. Staying adequately hydrated helps to flush out toxins, keeps our mucous membranes lubricated, and supports the natural cleansing processes of the vagina. When we're dehydrated, our bodies conserve water, and this can lead to a decrease in vaginal lubrication, making intercourse uncomfortable or even painful. Dehydration can also make us more susceptible to urinary tract infections, as bacteria can linger in the urinary tract when there's not enough fluid to flush them out. In today's fast-paced world, stress has become an unwelcome companion for many of us, casting a long shadow over our physical, emotional, and yes, even our vaginal health. Chronic stress wreaks havoc on our bodies, disrupting hormonal balance, suppressing the immune system, and making us more susceptible to a host of health issues, including vaginal infections. When we're stressed, our bodies release a surge of hormones, including cortisol, often referred to as the stress hormone. While cortisol plays an important role in our body's stress response, chronically elevated levels of cortisol can suppress the immune system, making us more vulnerable to infections, including vaginal yeast infections and bacterial vaginosis. Stress can also manifest physically in the vaginal area, leading to muscle tension, pain during intercourse, and even a decrease in libido. After a long day, there's nothing quite like slipping into comfortable pajamas and snuggling up in bed. But when it comes to vaginal health, those cozy pajamas might not be doing our lady bits any favors. Wearing tight-fitting underwear or pajamas to bed, especially those made from synthetic fabrics that trap heat and moisture, can create a breeding ground for bacteria and yeast, increasing the risk of infections. Sleeping Commando, on the other hand, allows for air circulation, keeping the vaginal area dry and reducing the likelihood of bacterial or yeast overgrowth. Exercise, often touted for its mood-boosting and heart-healthy benefits, can also work wonders for our vaginal health. Regular physical activity improves blood circulation, strengthens the pelvic floor muscles, and helps to regulate hormone levels, all of which contribute to a happy and healthy vagina. Improved blood circulation, a key benefit of exercise, delivers oxygen and nutrients to the tissues of the vagina, promoting healing and maintaining overall health. Exercise also helps to strengthen the pelvic floor muscles, those often overlooked muscles that support the bladder, uterus, and rectum. In a world obsessed with quick fixes and one-size-fits-all solutions, it's easy to forget that our bodies are as unique as our fingerprints. What works wonders for one woman might not have the same effect on another, and what feels normal for you might be a sign of an underlying issue for someone else. When it comes to vaginal health, there's no substitute for listening to your body's whispers, those subtle cues and not-so-subtle signals that tell us when something is amiss. Pay attention to any changes in your vaginal discharge, odor, or overall comfort level. Notice how different activities, foods, or products make you feel. We stand at the cusp of a new era, one where women are finally breaking free from the shackles of silence and shame that have long surrounded their bodies. The whispers are transforming into a chorus of empowered voices, demanding accurate information, compassionate care, and a seat at the table when it comes to decisions about their own health. No longer content to be passive recipients of outdated advice and potentially harmful practices, women are embracing a proactive approach to their vaginal health, seeking out knowledge, advocating for their needs, and challenging the status quo. This shift in consciousness is not merely about vaginal health, it's about reclaiming the power that comes with understanding and caring for our bodies. It's about dismantling the societal norms that have sought to control and dictate women's experiences with their own bodies. It's about recognizing that our vaginas are not sources of shame or embarrassment but integral parts of our overall health and well-being, deserving of the same care and attention we give to any other part of our bodies. For far too long, misinformation, cultural taboos, and a lack of open dialogue have created a breeding ground for myths and misconceptions about vaginal health. These myths, often perpetuated by well-meaning but misinformed individuals or industries seeking to profit from women's insecurities, can have real and potentially harmful consequences. From the myth that douching is necessary for cleanliness to the belief that vaginal odor is inherently offensive, these misconceptions can lead women to adopt practices that disrupt their vaginal health, increase their risk of infections, and undermine their sense of self-worth. But knowledge is power. By arming ourselves with accurate, evidence-based information, we can challenge these harmful myths, make informed decisions about our bodies, and advocate for our health with confidence. We can learn to differentiate between normal bodily functions and signs of potential problems, empowering ourselves to seek appropriate care when needed. Our bodies are constantly evolving, undergoing a series of transformations from puberty to menopause and beyond. Just as our skincare routines and exercise regimens adapt to these changes, so too should our approach to vaginal health. What feels comfortable and normal in our 20s might feel different in our 40s, and understanding these shifts is key to maintaining optimal vaginal health throughout our lives. From navigating the hormonal fluctuations of puberty and the demands of pregnancy and childbirth to managing the changes associated with menopause, each stage of life presents unique challenges and opportunities for vaginal care. Let us celebrate the incredible resilience and adaptability of our bodies, those intricate vessels that carry us through life with strength, grace, and an unwavering capacity for healing. Let us embrace our vaginas not with shame or secrecy, but with a sense of wonder and appreciation for the vital role they play in our overall health and well-being. Let us continue to challenge the societal norms and outdated beliefs that have sought to silence our voices and undermine our power. And let us move forward with knowledge, confidence, and a deep sense of self-love, knowing that our bodies are our own, and our vaginal health is a precious gift deserving of our unwavering care and attention. Please like and subscribe. Until next time, take care of yourself and each other.